Hello everyone, and welcome to our tutorial on coronary artery disease. It's a super high-yield topic for USMLE steps. So let's start with the definition. What's coronary artery disease? So coronary artery disease involves some kind of ischemia that affects the heart due to narrowing or blockage of the coronary arteries. And the most common cause of narrowing of the coronary arteries are the atherosclerosis. And this narrowing or blockage will result in some kind of a mismatch between the oxygen demand and the oxygen supply of the myocardium. So when the myocardium is asking for more oxygen and this ask is more than the supply what the myocardium is getting, then ischemia symptoms happen. There is main two subtypes of coronary artery disease. The first one is angina, which involves ischemia but without necrosis, and the second subtype is myocardial infarction, which also involves ischemia but with necrosis. So this is the pathophysiology of atherosclerosis. It basically involves an accumulation of a plaque. This plaque progresses with time, causes progressive stenosis of the artery. So also ischemia may lead to some changes in the ECG. If the ischemia is partial, there is partial wall ischemia, then ECG will show ST depression and or T-wave inversion, like this example. If there is transmural ischemia involving the whole myocardial wall, then this will result in ST elevation and or pathological Q waves. So comparing the different subtypes of angina, we basically have stable angina, unstable angina, and vasospastic angina. Stable angina usually happens due to atherosclerosis. There is blockage or stenosis, and this stenosis involves more than 70% of the lumen diameter. Stable angina shows symptoms only on exertion, and it's relieved by rest, or it may also be relieved by nitroglycerin, which vasodilates the coronary arteries. Unstable angina involves a thrombosis with incomplete occlusion. So, for example, if this plaque here ruptures, a clot of the blood will accumulate and causing an occlusion of the artery. So this is the pathophysiology of unstable angina, but the occlusion in unstable angina is incomplete. This pathophysiology is also the pathophysiology of non-STEMI, but the difference between unstable angina and non-STEMI is that in unstable angina there is no necrosis, so there is no troponin elevation. Unstable angina exists on rest, it's not relieved by rest. All right. And the third one, the last subtype of angina is vasospastic angina, which basically happens not due to atherosclerosis, but due to episodic coronary artery spasm. These spasms are mainly triggered at night, and it causes transient ischemia of the whole myocardial wall. Smoking is a major trigger, so smoking cessation may decrease the episodes, and it's mainly treated by vasodilators like calcium channel blockers and nitrates. In stable angina and unstable angina, there is partial ischemia of the wall, so there is ST depression and the T-wave inversion, or in vasospastic angina, there is a transmural ischemia, so there is transient ST elevation. The second subtype of coronary artery disease is MI, and it involves complete or incomplete coronary artery occlusion, which happened also due to a plaque rupture like unstable angina. If the occlusion is complete, this will result in an STMI. If the occlusion is incomplete, this will result in an STMI, and it may also result in unstable angina as mentioned before. So this is the pathophysiology of MI. There is a plaque rupture. This plaque rupture may result in a complete occlusion of the artery, causing transmural ischemia, resulting in an STMI, or this rupture may cause partial occlusion, resulting in a subendocardial partial wall ischemia, causing ST depression or T-wave inversion. So comparing MI versus angina. So basically, angina, there is no infarction, so there is no troponin elevation. On the other hand, in STMI or non-STMI, there is elevation of troponin due to infarction. Also, symptoms of non-STMI and STMI happens at rest, like unstable angina. And in non-STMI, there is subendocardial ischemia, as shown here, partial wall ischemia resulting in partial wall death, while here there is total wall death, complete wall death, transmural wall death. And all of these three subtypes involve partial wall ischemia, so they will result in ST depression and/or T-wave inversion, while in transmural ischemia, like vasospastic angina, there is transmural. In STMI, there is transmural ischemia, like vasospastic angina, so it will result in ST elevation with pathological Q waves. So here's a mini quiz. Which of these subtypes present with chest pain at rest and elevated troponins? So if there is elevated troponins, this means there is death of the myocardium. So we'll choose the answer that involves infarction. So vasospastic angina does not involve infarction, neither unstable angina, neither stable angina. So the right answer would be non-STMI. I hope you enjoyed this session and see you soon.